No-hit zones promote a safe environment for kids where hitting of any kind is not allowed, including spanking. Salina pediatric neurologist Dr. Britton Zuccarelli joins me to discuss no-hit zones. Dr. Zuccarelli, what are no-hit zones?
No-hit zones are designated areas that are labeled as being caring, nurturing environments where they're free of corporal punishment techniques. This idea was developed in hospitals across the country because the American Academy of Pediatrics discourages corporal punishment as a disciplinary strategy. We have ample evidence in the literature that negative experiences or adverse childhood experiences in early childhood, including physical, emotional, and sexual abuse, of course, but even household dysfunction can contribute to adverse health outcomes later on in life, including mental health disorders, substance abuse, as well as other health conditions like heart disease and cancer, and even mortality. And so there's been ample evidence to support programs that foster different disciplinary strategies. And so no-hit zones were first adopted in hospital systems to train staff such that no child will hit another child, no child will hit an adult, no adult will hit a child, and no adult will hit another adult.
Let's talk about the conversation that you probably have had with parents, and will have many more with, about this, especially if they come from an environment of spanking. And how do you talk with them about that?
Of course, it's difficult in the moment when everyone is angry to try to de-escalate that. And so the no-hit zone really focuses on prevention strategies. So recognizing the early signs of either parental distress or child distress or caregiver distress so you can intervene early. So for instance, listening to raised voices or terse responses and intervening then. But when we are in a calm way discussing how to discipline children, I direct parents and other care providers to resources like redirection techniques, distraction techniques, so that they can use an alternative way to teach their child what they are intending for them to learn. So for instance, for a child, it's confusing to hear "we don't hit" and then be hit. Right. So we want to teach them the right way to express their anger and frustration.
You mentioned resources. One resource is obviously talking to your pediatrician. What are some other resources parents can have?
In addition to the pediatricians in this community, there's an excellent organization called CAPS, which stands for Child Advocacy and Parenting Support Services. And they have excellent materials and also courses you can go to learn how to deal with those challenging behaviors that young children have. Also, healthychildren.org has ample resources from the American Academy of Pediatrics on alternative disciplinary strategies.
Thank you so much for some great information and being on the show.
Thank you very much.
For more information, please visit salinapediatriccare.com and like them on Facebook.